This is a paid advertisement.
Welcome back to the Noon Show on WBAY TV2. This is Ask the Expert, and this is Dr. Kurt from Tower Clock Eye Center with us today. It's great to see you, Doctor.
Thank you.
Whenever we get a chance to visit, I like to talk about the evolutions and the new things that are available. Cataract surgery is one of those areas that seems to always be evolving and offering new options.
Right.
There are quite a few options when it comes to lenses for the patient, isn't there?
There are, yeah, and that's part of the discussion. That's actually the bulk of the discussion that we have with the patient when they come in for cataract surgery. We want to make sure that we take the time to first of all, examine their eyes, go over the nuts and bolts of what to expect during surgery, but also have a really thorough discussion about what their options are for lens implants, because that's going to impact what their vision is going to be for the rest of their lives.
In particular, there are a couple of newer options for patients. What are those?
That's right. So there are two new, what we call multifocal lenses. These are lens implants that are designed to restore a full natural depth of focus. The idea being to get away from glasses and contact lenses.
So how does it exactly work in the eye of the patient?
Well, the nice thing about this is that both of these lens implants really rely on just optics and physics to allow the patient to see well. It doesn't really require the patient's eye to do anything, all right? So the patient doesn't have to adapt or learn anything different. Once the lens is in and once their eye's healed, they're just going to view the world naturally, okay? But the PanOptix is probably our main workhorse now. This is a lens that came out about 1.5 years ago, and it's the first trifocal lens implant that was FDA approved in the US. So it allows both eyes to see well at distance, intermediate, and near, and it works really well. There's over a 94% chance of spectacle independence with that type of lens. Patients who had those implanted had a greater than 99% likelihood that they would choose that type of lens again if they had to have cataract surgery again. As a converse to that, or as an alternative to that, there is an even newer lens called the Vivity that does a very good job of distance and intermediate. It lacks a little bit of the near vision that the PanOptix does. And the reason a patient might choose the Vivity over the PanOptix is that the Vivity has a little bit lower chance of glare and halos at night after surgery, although both lens implants actually do very well in that regard.
And knowing which one to choose is really a part of the entire evaluation process, isn't it?
Yeah, exactly. So that's a lot to, when patients come in for cataract surgery, there's a lot of information to absorb. So we like to make sure that they've got a good, solid amount of time with one of our technicians to go over these options, and then also time with the surgeon to go over these options, again, to make sure that they're comfortable with their choice and they've had all their questions answered.
Getting started at Tower Clock is as easy as following the information right there on your screen. We'll get you back to the Noon Show right after this.
The preceding was a paid advertisement.